All right, we'll make a start. So, good morning and welcome to Casey Fields for today's coronavirus update. I've got a fair bit to get through, so my thanks all for joining me here today. Can I just confirm there are 1,993 new cases of coronavirus in the state yesterday. All of those cases are locally acquired, and that takes us to 21,647 active cases of COVID in our state at this time. I'm sad to say that 7 Victorians have lost their lives as a result of COVID in the last 24 hours. That includes a man in his 80s from Darebin, a woman in her 70s from Whittlesea, a man in his 80s from Moonee Valley, a woman in her 60s from Casey, another woman in her 60s from Darebin, and a man in his 50s from Hume. I'm also very sad to confirm that a 15-year-old has very sadly passed away, we believe, with a number of conditions, but she was COVID positive. And of course, in this very sad, tragic case, we won't be making any more comments on her, but we will and do send our very best wishes to her family and, of course, the family of all those who've lost their lives with COVID, particularly in the last 24 hours. There are 798 people currently in hospital with COVID. That is a significant jump in the last 24 hours, and we think it reflects the increase in cases we've seen in the last 10 days, 14 days or so. We have 163 people in ICU, and 106 of those are on a ventilator. Of those people in hospital yesterday, 89.2% were not fully vaccinated, and of those in ICU yesterday, 95.9% were not fully vaccinated. Yesterday, we administered and delivered over 40,000 vaccines, 40,386 vaccines through our various state clinics and pop-ups, and I'll come back to that story in a moment. We also processed 79,214 tests. I'm pleased to confirm now we continue to make good progress on the vaccination programme, and helped, of course, by those really strong numbers yesterday on vaccination. And I'm delighted to confirm that over 5 million Victorians have now received their first dose of a vaccine. So over 5,006,000 Victorians are now at least first dose vaccinated. That means that 88.5% of the over 16 population has now had their first dose, and 64.3% have had their second dose. And all those numbers continue to rise across all those age groups in a really encouraging way. And my thanks to everybody who continues to come out and get vaccinated, and really good to see especially those second doses now accelerating as we hurtle towards our 70% and 80% milestones for double dose vaccination. In terms of the cases, in terms of the distribution of our cases, we're seeing a fairly predictable spread that we've seen over the last few weeks. So in our northern suburbs, we have 457 cases. That's now under a quarter of today's cases, and we are seeing over the last 10 days, 2 weeks, a very consistent pattern whereby the northern suburbs are a decreasing share of the state's COVID activity, and we think that's a reflection of the really fantastic work done by so many across our northern suburbs, our local councils, local health services, co-health, and of course the thousands of people in the community who've come out to get vaccinated, and it's encouraging to see the impact that all those activities are having in reducing transmission, relatively at least, in the northern suburbs. In our western suburbs, we have around a third of our cases today, 642 cases. In our eastern suburbs, 111 cases. And in the southeast, 602 cases, again, almost a third of the total for today. Across regional Victoria, we have 168 new cases today, which takes our total cases in regional Victoria to just under 1,500. So again, a consistent and gradual increasing trend of cases across many regional Victorian communities, all around the themes of ongoing household-to-household transmission and wider community transmission, and of course a lot of work happening across many regional communities to minimise that as much as possible. We have 22 cases in Greater Shepparton today, most of them linked to well-established and understood household clusters. We have 26 cases across Geelong, again mostly linked to existing cases and known exposures. 17 cases in the Latrobe Valley, again well connected into those communities that we've been working with, and 22 cases in our Baw Shire cluster across Warragul and Druin, and again some good work happening there with local communities to reduce those numbers. We are seeing a tick up in cases in Greater Bendigo with 17 cases in today's numbers, and a lot of work happening in that space. And finally, 16 cases in Mildura. Of course, yesterday we confirmed that Mildura is extending its lockdown, and my thanks to the whole team across Mildura and Sunraysia for the work they're doing to support those positive cases in the northwest of our state. We have over 200 active cases now in Mildura, 202. The majority of those cases are young people, particularly in their 20s, but we're seeing very high testing levels across the LGA. Really seeing a good effort of the community coming out to get tested. We've also got and I'll talk more about vaccinations in a moment, but we're of course here at the Casey Fields because we're running our 3-day pop-up, vaccination pop-up. We have 19 of these pop-ups taking place over the weekend. So obviously this one here, of those 19 pop-ups, 16 are at various school sites. And my thanks to schools at this most busy time of the year as we're starting to see kids finally return back into school. It's great to see so much vaccination activity happening at a number of our schools across the state, including right here in Casey at Glen Eagles Secondary College. And I'm sure that'll be just as busy as we're seeing here at Casey Fields. I'd also like to thank our local GPs. Of those 19 sites, 8 are being supported actively by our local GP clinics, and it's a great partnership that we have between the state, the pharmacies and our GPs to really get vaccination done in as many ways as possible for as many people as possible and to make it as accessible and as easy as possible for people to participate. We'll also, next week, we'll be running 2 tailored pop-ups, particularly for the LGBTIQ community, and my thanks to the Pride Centre at St Kilda Road and Queer Space at Drummond Street on Carlton for their fantastic partnership to bring vaccination into the heart of their communities. Again, it's another way in which we can reduce barriers and make it that bit easier to create a safe and comfortable place to get the vaccination done and for you to, for us all to move on together. So talk a bit here about really in the southeast and what's happening here at Casey Fields. We've now seen over 1 million vaccinations delivered across the southeast, and not only are we seeing obviously significantly growing case numbers here, but we're really stepping up the rate of vaccination across the wider southeast. We've had over 30 organisations involved in the wider vaccination programme across the southeast, and I'd like to do a particular shout out to Monash Health for just the most phenomenal work they've been doing up and down the southeast, all across our wider southeast metropolitan area, and all the way, of course, down into the Mornington Peninsula. Yesterday here at this particular site, we started yesterday, we're here for 3 days. We did 428 doses, so it's 428 people that either started their vaccination journey or completed their vaccination journey. And it's been great to see, as I stood downstairs, just a sheer diversity of the community coming forward. This really is a reflection of every aspect of Casey. It's Casey in all of its diversity and strength, and it's wonderful to see so many people coming forward. And a particular shout out to the many community leaders we've been working with for the hard yards they've been doing, the volunteers, the interpreters, and people just talking in their local community about the importance of vaccination and addressing the real, the genuine concerns that some people may have and allaying those fears and helping them to come and get their vaccination done. In terms of the outbreak, we are seeing in the southeast now an increasing number of cases, and in fact Casey here, where we are today, now has the most number of cases today of new cases. 1,863 active cases right now in the Casey LGA area, and we're seeing this pattern across the wider southeast. If I look at locations like Hampton Park, Cranbourne North, Clyde, and near Warren, we're seeing significant growth in cases across those communities. Similarly, across Dandenong, Noble Park, and Keysborough, and we're also seeing significant growth a bit closer in Frankston and out towards Cardinia. We're seeing continued growth of community to household transmission across a number of different communities, and really I'd urge people, if you're in the southeast, just recognise the level of COVID infections that we're seeing around here, and please, if you haven't been vaccinated yet, please get that done. We are seeing a strong testing response, both here in the southeast and of course across the state as a whole, with 79,000 tests done across the state. We continue to set really high numbers, and that's a really important way for us to ensure that those who do have COVID can really minimise their risk of transmission onto other people, and we can try and slow down the growth in numbers that we're seeing. We have of course additional testing capacity out here in Cranbourne. So at the testing hub in Cranbourne on Thompson's Road, there's now a 6 testing lane giant testing centre, which is again delivering a huge number of tests and helping people to come forward and get their tests done. Finally, the vaccination numbers, I think, speak for themselves. Not only are we seeing an increasing rate across the state as a whole, but also here in the southeast, where particularly the second dose vaccination rate is rising steeply. And of course, we're now really focusing on those remaining parts of our city and remaining parts of our communities where there's still more work to be done. And we're in particular here in the southeast, we're targeting 11 postcodes where we still have vaccination rates below 80%. Of course, the good news is that the vast majority of the state's now well above 80%, in fact 88.6%, and we'll keep going until we get it done. And then finally, just a shout out to not only to the clinical teams and the entire teams that are here, not only at Casey Fields, but all the vaccination sites today. These guys do a phenomenal and difficult job. They are dealing literally with hundreds of people every day who come in to get their vaccination. And please, when you see them, say thank you. They do such an important job to keep all of us safe. With that, I'm happy to take any questions. Yeah, so I think with the, I don't have the 11 postcodes in front of me, but what we're doing in all those postcode areas is it's really targeting all these pop-up sites right into the heart of those communities. So with the 19 pop-ups taking place this weekend across the state, with the pop-up sites will be running next week as well. They're increasingly targeting those individual postcodes, those individual suburbs where we're still seeing lower vaccination rates. And it's all around trying to make it as easy as possible, but also as comfortable and as, I guess, a welcoming environment as we can to enable people who haven't yet got their vaccination done to just make it happen.
Do you have a breakdown of the vaccination numbers today, what the number of first doses and second doses, what percentage of second doses?
Yeah, so I think in terms of the 40,000 or so vaccinations that the state clinics did yesterday, over 80% of those are now second dose vaccinations. So we're increasingly seeing, particularly the state clinics, are really focusing on those second dose vaccinations. What we find in the pop-ups is that typically around about a third to 40% of the vaccinations we do for these walk-ups are people that are getting their first dose done. So these are people who've not yet found their way, but increasingly we're also seeing second doses come through, which is why our second dose rate is now rising more quickly than the first dose rate, but still with 88.6% of first dose vaccination across the state for adults. That's a really strong number, but we're seeing that increase every day. And again, if you look at those older age groups, those of us over 40, over 9, but we're at 90, 91, 94% first dose vaccinated. So we're seeing really high numbers, and they continue to rise.
We obviously had the focus in the north and west in
Yep.
recent weeks as a result of the case numbers there. Did it result in this area in the southeast becoming a bit of a blind spot, that we didn't put enough down here?
No, not so much, because 4 or 5 weeks ago, when we started with our LGAs of concern, absolute focus on the north and west, but we did identify Dandenong and Casey in particular, Greater Dandenong and Casey, as two areas that we were concerned about, so they were included in that initial rollout. So we've already started to boost those vaccination hubs around here and boost those vaccination numbers. So although absolutely the initial focus was north and west, certainly Casey and Dandenong were part of that initial rollout, and we can see that their numbers are rising very quickly on the back of that.
And is it apparent that the message of that household-to-household transmission isn't getting through to some of the communities around here?
Yeah, look, I think that's something we've seen consistently across this whole Delta outbreak, which is that it's proven to be very difficult. I think when we see the level of active community cases for that household transmission to slow down, although we're seeing lower rates of increase now compared to where we were 4 weeks ago and 6 weeks ago, we're still seeing a significant level of household to household transmission. And of course, people, this is it's a complex message to get through. I think increasingly what we have to be aware of is that all those day-to-day behaviours that we all want to do, but that are still not things that we can afford to do, are all enabling the virus to spread. And the virus is now spreading amongst the unvaccinated. Again, well over 2/3 of the cases that we saw yesterday are amongst people who are not vaccinated at all. So it is disproportionately impacting those who have not even had their first dose, let alone their second dose.
Are we still seeing a lot of new homes being brought into the numbers
Yep.
as well, rather than spreading within where new cases are on?
Absolutely. So I don't have the numbers for the last set of 1,993 cases, but certainly we've seen very consistently over the last 8 weeks, around half of the cases in each particular day are within existing households and half are new households. So again, based on today's number, there'll be about another 1,000 households today that have somebody with COVID living in them, and we would expect to see significant numbers of cases coming out of those households in the days ahead. And this is why this keeps growing. Although we're not seeing we're not seeing mass spreader events. We're not seeing those big super spreading events we've seen in earlier outbreaks. What we are seeing is just this really slow rolling set of outbreaks as transmission goes from one household to the next. the numbers in each houses to continue to increase, and we continue to see that underlying growth we've seen over the last 5 or 6 weeks or so.
We've seen case numbers hover around the 2,000 mark
Yep.
for a few days now. Obviously, there's a delay in that affecting hospitals. When do we think that our hospital system, which is already under a lot of pressure, is going to feel the most intensity from the current sort of
Yep.
outbreak? And what are we doing to put in place to
Yep.
ensure that the resources are available?
Yeah, so there's a huge amount of work going to ready and to prepare our hospital system for the growing caseload and the growing workload that we see in the weeks ahead. So typically we see around a 10 to 14 day lead-in period to a rise in case numbers of active cases in the community leading through to our hospitals. If I look at the increase today in hospital admissions, about 100 more people in hospital today than this time yesterday, and we put that down to that significant rise in numbers we saw around a week or 10 days ago. That's typically how long it takes for those numbers to feed through. Look, our hospitals and health services are doing an amazing job in caring for people. I mean, right here at Clayton, we've got 43 COVID patients. At Casey, we've got 37 COVID patients. That's a lot to bear within an individual hospital setting, and those patients, of course, need a lot of complex care from our health staff. We've got a lot of work happening across all of our hospitals around creating the more bed space, creating those COVID-safe wards, and of course that has an impact on our capacity across the wider health system to care for other people who also need clinical care.
Is that rate that we've seen today, is that going ahead of what we were expecting, or is it on par given, as you say, 10 days?
No, it's on par. And if you look at the Burnett modelling that we shared 4 or 5 weeks ago now, we knew that the peak in case numbers we would expect to see would be towards the back end of October, but we also know that the peak of hospital admissions and complex cases is well into November and December. So these are predictable events in terms of, as you see the case numbers rise, you have a lagged effect in terms of people being taken into hospital. We are still, certainly in terms of our caseload numbers, with our 7-day moving average, we're slightly ahead of where the Burnett modelling would have had us be. That's obviously a cause for concern, and again, it makes the numbers over the next few days really important. But in terms of hospital admissions and ICU cases in particular, we're under where those Burnett projections had us. Of course, it's only a model, and we continue to update that modelling and to update it in terms of what we're actually seeing on the ground.
Given the numbers that we've got today, we've obviously heard lots of times that we're still going to stick to the roadmap, we're still reopening where we hit 70%. When do you see that happening, and what do you see the numbers doing? I suppose if we're looking only 4 or 5 days in advance now, are we still likely to have 2,000-ish cases and be opening up further?
Yeah, look, it remains, to be honest, it remains to be seen. I think if when Brett spoke to this about 5 or 6 days ago, before we saw that jump up to that 2,300 number a few days ago, we felt increasingly that we might be at a plateau. Clearly, we weren't at a plateau now, so we'll now wait and see whether what the numbers tell us in the next couple of days as to whether 2,000 is our new turning point, or whether that's just another step into further higher numbers. Again, let me stress, this is something that we all control, and this is all that the case numbers tell you is how many people are moving around the community, and how effective are we at social distancing and mask wearing and all those hygiene things, and how effective are we being at getting ourselves vaccinated. So this is something that we all generate between us. Our hope and our intention would be that we'll expect that we would want to see those case numbers start to turn in the next week or two, as predicted by the original the modelling. We would obviously we'll watch that very closely, but the real constraint on us is what it does for our hospital system. That is ultimately that's the capacity that we need to manage. That's a critical part of our system, because we need to ensure that those people who are getting COVID, as well as the wider community and whatever else other support people need, that we have the capacity to do that within our health system.
When are we likely to hear when those roadmap changes are taking effect? Obviously, you haven't got a minister with you today.
I don't indeed.
Sorry to ask, I know it's not your responsibility.
That's right.
But when do you expect that Victorians will know when that 70% freedom kicks in?
Yeah, look, I think that's a few days away. Yep. So obviously it's a matter for government and the Chief Health Officer around Brett's advice in terms of when those settings are appropriate. I think the roadmap is very clear about what we can expect to see at 70% and 80%. I think our vaccination numbers, we set the date of 26th of October as our indication of the roadmap around when we might hit 70%. It looks like we'll be a few days ahead of that, but I'd expect there to be ongoing discussions and commentary over the day and week ahead.
Obviously, there was a lot of commentary yesterday about the border changes that come into place from 11:59 on Tuesday. Has there been any more clarity about what those rules will mean for Victorians? Obviously, the interpretation yesterday was that Victorians currently will be more limited in how far they can travel and what they can do than visitors coming from New South Wales.
Yeah, look, I don't think there's any great mystery around this, and let's be really clear. The controls that we have as Victorians are based on the public health situation we have here in Victoria, and we've laid out pretty clearly in the roadmap what the Chief Health Officer's expectations would be around how those restrictions progressively get eased over 70 and 80%, and those deadlines are now days away, even rather than weeks away. So I think that turning point's pretty soon. But until such a time, if you're in Melbourne, then we'll continue to be constrained to the reasons to leave your home. The only people who are really moving around are the essential workers under a very strict set of conditions, particularly around being double vaccinated. It does mean what we've tried to do is to normalise the situation with New South Wales and Victoria that really opens up future opportunities to allow easier travel between New South Wales and Victoria as our situation from an epidemiology point of view starts to become broadly similar, and it does enable those Victorians that have been in New South Wales for such a long time to find their way home more easily and under a more appropriate risk framework, given the number of cases we now have here in Melbourne and Victoria. And it does allow some people in New South Wales who may wish to make use of that to come back into Victoria more quickly. Of course, when those New South Welshmen do come into Victoria, they'll be captured by the constraints here that apply to all of us. So a New South Wales or a Sydney visitor can absolutely come to Melbourne, but they'll then be constrained to the conditions that are here in Melbourne, which means they can't just freely travel back into Sydney. So it's these conditions will evolve quite rapidly over the coming weeks as we go through both states' roadmaps, and I think this is just a sensible way of allowing certainly Victorians and New South Wales to come back more easily, and to allow those who've got critical business to do here in Victoria to do so as well.
What would you say how there would be a bit of concern though for some Melburnians if someone from Sydney can land at Tullamarine, head to the surf coast and have a week away down there under the regional conditions, sticking to the rules that are in regional Victoria, but on a holiday on the surf coast when a Melburnian in the middle of the city doesn't have the freedom to do that?
Yeah, look, I think, but essentially that's more of a commentary on the current conditions and constraints that are in place in New South Wales. So, we can't comment and advise on what the conditions are in Sydney. That's a matter appropriately for New South Wales Health. If they're in a position where New South Wales people can travel more freely, then that's really a matter for them to discuss. I think from our point of view, we've had a long time where it's been very hard for Victorians who've been in New South Wales for many months to come back, and I think we've reflected on that, or the Chief Health Officer has reflected on that, and revised those conditions so that we don't need to go through the full complexity, recognising that anybody who's coming back into the state has to be double vaccinated, has to have tested negative, so at the point at which they come in, they present no greater threat than the rest of us do with the level of cases we have circulating in Melbourne at the moment.
No greater threat, but a greater option to move around though. That's the concern obviously from Melburnians, that, as I say, not necessarily a greater threat, but they're able to do things that.
Well, yes and no, but I think we're drawing on some, we're clutching at straws really to find some quite extreme examples of what people may or may not want to go and do. I think as soon as if people from New South Wales choose to come to Melbourne, they are caught by the same restrictions and constraints that all of us have here in Melbourne. They're no different in that regard. The conditions that you are caught by depend on the place where you are, not where you come from. The only way you can come back into our state is if you're double vaccinated and you test negative. And I think it's a recognition that we're in a very different environment than we were in 6 weeks ago in terms of the level of the pandemic here in Victoria and normalising those relationships between New South Wales and ourselves.
Is leaving home for a Melburnian to get on a plane to go to Sydney an option?
No.
The deadline, obviously, yesterday for authorised workers to have at least one dose or have a booking, and also for healthcare workers. Healthcare staff have come out today saying that thousands possibly have been stood down because they're refusing to be vaccinated. Do you actually have a figure of how many healthcare workers are refusing and have been stood down?
Look, I don't have a figure. I think thousands would be a remarkable number to get to. So you look at the uptake of vaccination and, frankly, the enthusiasm for vaccination amongst healthcare workers, recognising that the vast majority of our healthcare workers are on the front line in the most hazardous environment and most at risk of contracting COVID through members of the community seeking access to their health services. So every single healthcare worker I've spoken to in the last 6 months has been desperate to get the vaccination job done to protect themselves and their workforce and, of course, their families. So I don't see this as being a large-scale problem. We know that 90% of healthcare workers in every setting have already taken up and completed their vaccination journeys. Will there be isolated individuals who, for whatever reason, can't get vaccinated? They'll have a relevant and appropriate medical exemption, and I'm sure there'll be a small number who, for whatever reason, don't wish to get vaccinated and they need to find an alternative career choice. I think the vast majority of Victorians, given what we're living through, would think that's a pretty reasonable thing to do. I'm absolutely aware of, a few cases here, a few cases there. And look, I would urge those individuals, please consider what we're asking you to do is no different to what we're asking all Victorians to do, which is to protect themselves and their community, get vaccinated, and can we all just move on?
Well, you're not expecting a large impact on the
No.
health
No, look, I'm sure there'll be individual health services, there'll be individual community health services where there may be small teams and one person in a small team has a material impact. I'm not downplaying how significant a challenge this would be, but it's a completely paradoxical situation to put a local health service into, with having staff members who should both want to protect themselves most and who should be the most health literate, making such a bizarre decision.
What sort of checks will be in place for workplaces next week? Will there be on-site checks to make sure that people comply? Because it's such a high fine that people
Yep.
employing people. So what's the plan?
Yeah, so look, firstly, I think it's about making transparent and common sense arrangements in place. And I think the advantage of the vaccination position is we have left people in no doubt about what conditions apply and what businesses in particular and other organisations that are trading are being asked to do. And this is something that business organisations were very keen to have government make a decision on, to say, make it clear what people need to do from a vaccination point of view, so we've got a clear set of rules to implement. So that's been done. Only yesterday, over 500 site inspections were undertaken by our colleagues in sort of the justice and enforcement space, checking on individual businesses and organisations to see that they were complying with a whole range of COVID-safe rules, including whether they had appropriate checks in place to ensure their staff were vaccinated. So, there are people out there across our authorised officer groups and across other other enforcement organisations to make sure businesses are doing the fair thing, are doing the right thing, and deploying those rules. You should expect to be challenged and to be able to demonstrate that you've got controls in place that demonstrates that your staff are appropriately vaccinated and safe for themselves and their workmates.
Will that rate continue at about, you said 500? Given the rules have changed on Friday, do you
Yep.
expect that to be the same next week, or will the numbers?
The numbers will fluctuate from day to day, but I think that the 500 inspections and checks done yesterday, I think is a pretty good indication that we're not going to back away from this. There will be significant enforcement effort, and we've seen the impact that the positive impact that's had within the construction industry, where we're seeing really high rates of compliance with their new reopening rules. We'd expect, businesses are desperate to reopen. We all get it. None of us want to stay where we've been for the last 3 months. Businesses are desperate to reopen and to get on with things. They've asked for clarity. Clarity's been provided, and I'd expect the vast majority of them to do the right thing. And if I look at, 89% of adult Victorians having had their first dose vaccination, I don't think it's a terribly complex thing for them to comply with.
There have been a couple of exposures in the last week at the Children's Hospital.
Yep.
Are you aware of any onward transmission from those?
No, there's been no. So I'm aware of the exposures. There's been no evidence of onward transmission at that setting, and I think as we've seen more generally in our healthcare setting, because our healthcare workers are highly vaccinated because they're in Tier 3 PPE, and that's not an easy thing to do. We're seeing very low levels of onward transmission. We're testing people as they're coming into those hospital environments, and although it's not impossible, we'd hope to see those rates remain very low.
As you're planning to put in rapid antigen testing by the end of this week,
Yeah.
does that happen?
Yeah, so rapid antigen testing is becoming increasingly available, particularly in our healthcare settings. So we're expanding the role of that, particularly as a screening test for where that's appropriate, depending on the clinical circumstances of the cases they're dealing with. So many of our health services are now starting to use those tools. And again, it's an additional protection, it's an additional device alongside our gold standard PCR system. We'll continue to roll out more antigen testing for those kind of environments.
And in terms of checks on people from New South Wales coming in, there still are some restrictions, as you said, they have
Yep.
to be tested.
Yep.
And what sort of checks are you going to do into the homes of those people, or will it be the same?
Yeah, so look, we have a pretty significant home enforcement program whereby we do over 1,000, 1,100 checks every single day on people for a range of reasons. There has been a particular focus in recent weeks on red zone arrivals, so people who are under those kind of restrictions. That includes making sure that people obviously have the appropriate paperwork, have the appropriate permit, but also in order to get those permits, you've got to demonstrate you've had your vaccination and your negative test. And there, as I said, there's a large number of checks we do every day to make sure people are doing just that. And we find, of course, 96, 97% of people have done the right thing, because the rule, I think we've all been through this for long enough now. We all want to get to some form of normal. Asking people to get vaccinated is really what all of us are doing anyway. And ensuring we clear some negative tests is a pretty easy thing to do these days.
And in terms of the estimates for next week, do we know how many people are in New South Wales that would like to come down here while we're still under lockdown? Is there what was this decision, I guess, based on, of how many people need to come home?
Yeah, look, we don't. I mean, I think when we eased, we made a significant easing about 3 or 4 weeks ago from memory around the requirements around red zone moving, making it easier for Victorians to come back. I think we've seen, probably middle hundreds of people come back under those arrangements. I'd expect there to be a few hundred more people who are currently in those red zone areas within New South Wales, Victorians who'd want to come back. Look, we're talking, I think, generally speaking, of hundreds of people rather than thousands. And I think also we're all looking forward to very clear roadmaps both here and in New South Wales that says life is supposed to get a lot easier in the next few weeks. So I'm sure there will be people who are very keen to jump on these new arrangements from Tuesday when they come into effect. I suspect that the real momentum is going to start to happen later in November when both states hit their 80% deadlines and things should get a lot easier for the vast majority of us. No, I don't. Look, I've seen the reports obviously this morning. I don't have any more data on that. I'll try and find, if there's any more information, I'll put it in the Cho report this afternoon.
Just back on
Yeah.
back on South East.
Yeah.
Are you confident that we can get things under control in the South East? And if areas of the South East continue to lag behind in vaccinations, would you look at localised lockdowns or more targeted measures?
No, I think the focus we've had on the southeast will be very similar to the work we've done in the north and west. So we'll continue to surge in additional vaccination resources, additional localised vaccination teams to really support those people in those lower vaccination postcodes to come forward and get the job done. Look, and again, this is I know we're all tired. We're all at the end of this incredibly long journey of 20 months, and you kind of think the end's almost there. We just need to hold on to it for a little bit longer. Having numbers in the 2000s every day is not a place where we want to be because we know it's going to knock on to our healthcare system. So a significant proportion of those 2,000 people are at far greater risk of becoming seriously ill. We don't want them to see them in our hospitals, and that's why we want people to focus on getting their vaccination done and isolating for another few days and a few weeks just to give us a chance to get those numbers down a bit further.
Are you concerned about what might happen if we do potentially use restrictions next week down here? We're already seeing quite significant transmission.
Yeah, look, I think we're concerned about that situation across the whole state, which is that we have a large number of people who are rushing into the vaccination system, which is a really good thing to see. We know it takes a few weeks for that full vaccination effect to take effect, so there's always a slight raggedness in terms of how quickly the transmission rate is going to drop in response to that higher level of vaccination. But look, we also have to trust ourselves to be getting on with this. We have to trust ourselves to get on with vaccination. We're keen for those numbers to turn, but the real guide for us is what's happening in our healthcare and hospital system. There's a lot of work underway to make sure we've got the capacity underway. But I would urge everybody, as we start to get to those easing milestones, this isn't going to be a great big freedom day where everything can be forgotten and we can all go back to normal. There are still going to be sensible measures in place that says if once we're allowed to gather again outside or inside or under a scenario, there will be controls in place. We will be asked to wear masks. We will be asked to socially distance. If we all stop doing that, then those numbers will spiral very quickly.
And there are concerns locally that exposure sites aren't going up on the exposure sites quick enough. Are we still hitting our targets in terms of putting up those exposure sites on the website in a timely manner?
Yes, we are. So, I think on exposure sites, there's a good piece in the Age this morning around how we're refining, particularly here in the southeast, in fact, our contact tracing approach and how we work with exposure sites. So, particularly now that we're in lockdown, most of the exposure sites are really places that are under control. Our exposure sites are typically, they're schools, they're workplaces that are still operating under essential worker restrictions, and as such, we don't tend to publish those kind of sites. So, we don't tend to publish school sites because we know which students are in the school and we'll deal with the school directly to manage the contact tracing. So people shouldn't expect to see every time there's a positive case, we shouldn't expect to see hundreds of exposure sites. There are from time to time, when we're putting sites up, we want to make sure we've got the details right and recognise that the exposure sites can only be identified once we've found a positive case and once we've done the contact tracing with them and they've identified what their movements have been. So there's a fair bit of work to go. So it's not unusual to see an exposure site being listed when it relates to activity from 4 or 5 days ago, given that someone's had to get tested and to share that information in the meantime.
On that contact tracing change that you were talking about, are there positive cases now that can expect zero contact at all from DH other than a text with that email link?
Yeah, so every positive case gets contacted by us as by the Department of Health. You get contacted obviously by the lab provider who will give you your lab result. We will contact you to make sure you're okay. That will be by text initially. We'll have a triage message that goes out that says, let's understand where you're at, and we then follow through. But we prioritise our calls based on the risk and the level of concern around that case. So absolutely, typically, the cases who will get the least attention from us, if I put it that way, will be those who are existing household members, where we've already spoken to the index case within that particular household, where we understand the dynamics in that household, and we're confident they're getting appropriate care. I also recognise that every positive case is then moved into our COVID positive pathways program to make sure that from a health point of view that they're being appropriately managed and supported as they deal with their condition.
And just when you're talking about measures that are going to stick around for a while, we now know that in April 2022, the Formula One has got that.
Yep.
Feels like a lifetime
away, yeah.
But we've got the dates for the Formula One Grand Prix.
Yep.
Can you shed any light as to how that will be managed? Crowd numbers, what the expectation will be of people coming in from overseas, that sort of thing?
My crystal ball is not that good. So look, I think obviously we're all delighted, or some of us are delighted, some of us probably won't be, to have the Formula One Grand Prix confirmed for April of next year. Look, there's a lot of work happening with the Australian Open, with the Formula One, the FIA or the Formula One Association here in Australia, around how we manage those events in an effective and COVID-safe way. But the landscape is shifting really quickly. The primary control in place, the absolute bottom line will be vaccination, to make sure that anybody who's coming in to be part of those events and to spectate at those events will absolutely have to be vaccinated. How quickly we can move in terms of the density of the crowds that are there and what other controls we need, that's all work that's still ahead of us. And look, I expect that the next few months will tell us an awful lot. The way that we start to ease restrictions at our 70 and 80% vaccination rates, what that means for overall case numbers, and again, crucially, hospitalisation numbers and how we can manage that. And even the uptake of vaccination, we're closing in on 90% first dose in probably in the next, 4 or 5 days or so. That's a phenomenal set of numbers. So the higher those numbers go, the more other things become possible and the more other restrictions can be dialed back.
April well away, Christmas is a little bit closer.
Yeah.
You have a photo with Santa. There's put out some details today that you have to wear a mask, you've got to be socially distanced. Is that something being driven by the government, or is that a sort of shopping centre policy?
I think there will be shopping centre policy. I don't think Brett's issued a Santa direction yet at this point in time. So I think that is a little bit away still. So look, I think our focus is very much as the roadmap makes clear. We all want to have a really normal Christmas. We want to be able to gather at home, want to gather in pubs and clubs, and actually really enjoy a very important end of this really frankly quite complex and difficult year. So Christmas is very much about that. We're all gunning towards making that as normal as possible. And look, and as a community, we've all therefore got to manage in the coming weeks in a really effective and responsible manner. So if we can stay the path and hold on to what we've got, get the vaccination job done, keep that vaccination job going well into November and December, then Christmas becomes a lot easier for all of us.
Are you aware of how many medical exemptions have been granted for vaccine? How many medical exemptions?
I'm not aware of that, but it'll be a vanishingly small number.
Like, would you be able to give a percentage of the entire?
Not right here, right now. No, I'm not going to spitball a number on that one. Happy to have the team have a look at it, but again, this is all overseen through the Commonwealth system in terms of how those exemptions are registered. Happy to have the conversation with them to see what that looks like.
You've got the Federal Treasurer out today, apparently fuming that our roadmap doesn't reflect New South Wales.
Right.
Is that just not a reality for us because our cases are so high?
No, look. I'm not well placed to comment either on the politics of the Federal Treasurer or the roadmap, given that it's the Chief Health Officer's advice and the government's roadmap to deliver. It's my job to make sure we deliver all the elements within that roadmap. I think we've commented extensively over the last 3 or 4 weeks on the nature of the roadmap and why it's appropriate. We're all looking forward to getting to those 70 and 80% destination points and seeing what we're able to do at those different points. And those points are now so close. So I think my focus is very much around, can we just make sure we get the vaccination numbers so we get to those milestones, and the fact that we seem to be ahead on trajectory before the 26th of October is a good thing. Let's get to those dates and let's see what we can ease up when we get there.
With that comparison game though, do we have any plans, do you believe, to allow for international travellers to come back here into Victoria and not quarantine?
Well, that's the international travel is a matter for the Commonwealth, as I understand it. I'm not a constitutional lawyer, but I'm pretty sure it's a matter for the Commonwealth. So I'll wait for them to make decisions on international travel.
New South Wales has made the call themselves, so that they're going to allow that.
I'm not a New South Wales constitutional lawyer either, so I think that's a matter for both the New South Wales Commonwealth to work through how they're going to make that work. What I will say is I'll be delighted when it happens so I can go see my mum, but apart from that.
There's one of the impacts on our healthcare system. Reportedly 66,000 Victorians currently on wait lists for elective surgery.
Mm-hmm.
Is that avoidable, or is there anything else that we could have done to avoid having these repercussions that it used to?
No, look, I mean, it's a really stark reminder of the fact that dealing with COVID and seeing these avoidable case numbers has a real impact not only on the health of those with COVID who are then ending up in hospital and the 700 plus people who are in hospital at the moment with COVID, but also the fact that it means that we have to defer care for others. And that's a real direct human cost that we live every day. And I can only express my huge sympathies for those people who are living with long-term conditions, desperate to get their elective treatment done. And we can't do that at this point in time because we know there's going to be a surge of demand on the system, which is largely avoidable if the vast majority of us could cool our jets, stick with the restrictions that we've got, get vaccinated, and avoid these numbers continuing to rise. That is a direct daily price that we pay. The health system, our healthcare workers, the hospital management are working incredibly hard to get the balance right between what elective surgery can continue on and what we need to hold back to create room for COVID. But the reality is we have 700 beds being taken up today with COVID patients. They're sick, they need that treatment, and it means that others are having to defer the treatment where that's possible.
If household-to-household transmission is such a big problem, particularly down here in the southeast,
Yeah.
we don't have any flexibility on legally being able to do that until 80% at this stage.
Yeah.
Do you believe there is, I suppose, is it warranted or could it be a potentially good idea to give a bit of flexibility at 70% so that things aren't happening trying to be done under the radar if it was maybe
Yeah.
2 or 5 visitors to home?
Yeah, I think that's a matter for the Chief Health Officer to consider about the appropriate balance of those restrictions, and I'll leave it to him to grapple with that.
Given we're only a few days away, as you said, from reaching that 70%
Yeah.
milestone, is there a reason that you're not here with the Minister or the Chief Health Officer today, given there's some questions around the reopening?
Well, not really. Look, the reason I'm here today is that one of my responsibilities is the state's vaccination program, and I'm really keen to see how this pop-up hub is going and the wonderful work that we're doing with so many partners to make it happen. And also, given that Casey is one of our hotspots in terms of infection rate, to get a sense of how that's going on the ground and what else we can possibly do. That's my job to be here on those issues. I think, in fairness to the to the fourth estate, you get a pretty fair crack at government just about every day of the week. So. The fact you've got the short straw today is something you'll have to live with. On that note, thank you very much indeed. Thank you all.